Hello, and welcome to this mini distraction. I'm Dr. Ned Hallowell. Today, I want to play you a part of a conversation I had with my good friend, Dr. Beth Frates, a physician and a certified health and wellness coach. Beth has been a friend of mine for a number of years, and she's taught me a great deal about wellness. In fact, she did almost the impossible. She got a department started at the Harvard Medical School on wellness, and believe me, that's no simple feat. Wellness is certainly the direction mainstream medicine is heading in, as people take seriously the idea of prevention rather than simply treatment after the disease has hit. And Dr. Frates is a leader in that effort. Well, hello, Beth.
Hi, Ned. How are you?
I'm very well, thank you. I thought, Beth, we'd just jump right in your wheelhouse, which is the whole idea of lifestyle medicine and wellness. And maybe you could talk about what are the advantages of taking seriously wellness and what are the obstacles that our distracted world puts in people's way.
So lifestyle medicine is really a burgeoning area in medicine, not yet a specialty, but it is the part of medicine where we look at our feet, our forks, and our fingers. What do I mean by that? We see how we're moving, we examine what we're eating, and we try very hard not to use our fingers on cigarettes. So we're looking at our habits, trying to adopt healthy habits so that we can decrease our chances of disease and dying early or even developing disability.
Yes.
This translates really, Ned, to trying to reach the guidelines around physical activity, which are to accumulate 150 minutes of moderate intensity physical activity in the week. Moderate intensity means you can talk while you're doing it. So it would be a walk, perhaps a slow jog. Vigorous intensity is what you do, Ned, when you are playing squash. There might be some listeners who are saying, but actually I play squash and at times I can't talk when I'm exercising. So they would be in the vigorous category. And if people are exercising at that intensity, vigorous, then they need to accumulate 75 minutes of vigorous physical activity in the week. So it's half, as you can see. But if people can do this, they reduce their risk of morbidity and mortality, of disease and death.
So between 75 and 150 minutes a week, 75 if it's vigorous and 150 if it's mild.
Yeah, if it's moderate, right, exactly. Moderate is you can talk. If you go to mild, or what we also call low intensity exercise, that's in fact you could sing.
Yes.
If you're not winded at all, that means you're low. The guidelines are, look, if you're sitting most of the day, any listeners are sitting most of the day, the recommendation is to get up at least 10 minutes of the day. And if you're in the low intensity category, that's just fine. That's better. Getting up for 10 minutes in low intensity is better than sitting.
And it can be fun, right?
Oh, it's got to be fun. Pull out the hula hoop right now. I've got one. Do you have yours in the studio or no? So
lovemaking would count then, right?
Yes, I did say hula hooping, but you went right into the lovemaking. I did mention the hula hoop, and I was not a hula hooper growing up. I must have done it in PE in elementary school.
Right.
But the truth is, I work with patients now. You know this as a lifestyle medicine consultant. I've been trained as a physician and as a physiatrist, physical medicine and rehab. But then I went on to get motivational interviewing certification as well as health coaching training certification. So I work with people, and I try to get people who are sedentary to get up, find something they love, and get moving. And I mention the hoop because a 74-year-old patient of mine who lost 30 pounds over the course of 6 months and has kept it off for years, she was 200 pounds to start. At any rate, she was sitting most of the day, started walking. And how did she start walking? I run all my meetings walking. I believe you know this. So when I meet with patients, clients, I'm walking with them as we talk about healthy habits. And it's a new paradigm. In fact, the British Medical Journal just published my case report in February on walking meetings in lifestyle medicine for sustained weight loss.
Wonderful.
So it might be the next trend that we counsel patients as we walk. Some psychiatrists in New York actually have treadmills, 2 treadmills side by side, and they run their therapy sessions while walking. So there's a lot to the power of walking. Hippocrates.
Yes.
You know, we go back to his saying so many times in medicine, but walking is man's best medicine. So that's what he was saying, and I have found this to be very true. So this 74-year-old woman, back to the hoop, to come full circle there, she started walking, then guess what? She was really enjoying that. She moved to biking, and then that wasn't enough of a challenge. We're here in New England. She was snowshoeing, then cross-country skiing. You've got to find things that are fun, exciting.
Right.
Put the variety, the novelty in there. And then in our town, she lives in my town, there's a local recreation center, and she found a hula hooping class. The point is, moving your body is very healthy. Have you heard that sitting is the new smoking? Have you heard that?
I'm sitting down talking to you, Beth. I should stand up and
Can you stand? Do you mind standing? It would make me feel better. I'm sitting on my exercise ball as we speak.
Yeah.
But if you can't do that, that's where I'm going to go back to your point of a walk.
Yeah.
A walk can be very energizing.
Yeah.
You mentioned it can also reduce stress, and sure enough, results of a 5-minute walk show you can decrease the state anxiety, how anxious you're feeling at that time. With a 5-minute walk, it can also energize you. Or at that 3 p.m., that's when many of us get that lull. How about a call? I'd love you to call me, Ned, at 3 and be my power conversation. Mm-hmm. How about a power conversation? Right, a power nap, power conversation, power walk. Mm-hmm. How about if you're going to consume something, people say, I'm going to have some treat. How about making that nuts? Maybe with a few dark chocolates in it to get some kind of a pick-me-up that's actually a healthy pick-me-up. So these are your 3 p.m. pick-me-up options that are revolving around our conversation in lifestyle medicine.
Yes. Well, this has been so wonderful. I hope you'll accept my invitation to do this many times again, because I think I know you have such a treasure trove of practical information as well as inspirational information that our listeners would love. I can't thank you enough for joining us.
Well, thank you for having me.
Oh, thank you, Beth. We will talk again soon.
Sounds great.
Take care.
Okay. Bye-bye.
Well, that's it for today. Thank you so much for listening, and keep sending us your show ideas, questions, and comments to connect@distractionpodcast.com. We love hearing from our listeners. Distraction is produced by Collisions, the podcast division of CRN International. Collisions, podcasts for curious people.